Hello, I'm Dr. Schulze, and I'm bringing you a new series of videos for 2013. We finished with all the segments from an evening with Dr. Schulze that I filmed at the beginning of the year. So for the rest of the year, you're going to submit questions to my blog site, and I'm going to answer your questions right here on video on the blog site for the rest of 2013. So here we go. Okay, here's question 4,923. Only kidding. This question is from Vicky in Lodi, California, and I'm going to read it. Dear Dr. Schulze, I have a dear friend whose mother, who's in her late 70s, is considering a poop transplant because she suffers from a disease called C. diff, a terrible intestinal disease. Could she benefit from any of your products? I have been a supporter of superfood for years. How do I even approach this subject? Well, let's take a look at this. What's C. diff? C. diff is Clostridium difficile. Okay, Clostridium difficile. Difficile in Latin means difficult. So we know something is difficult here. It's a bacterial infection that causes diarrhea. It can be intense diarrhea all the way to a life-threatening inflammation that can kill you. There's 3 million infections of C. diff in America every year. Now, I know sometimes you don't believe me, so I'm going to quote the New York Daily News here. And let's see what the New York Daily News says about C. diff. It says there was a small study in New England Journal of Medicine, so we know that's the prestigious New England Journal of Medicine, about C. diff, a diarrhea caused by that, and cured by implantation of healthy feces into the patients after antibiotic treatments failed. Well, let's look a little further. It says it's a small new study concluded that inserting fecal matter from healthy people into the gut of someone with severe diarrhea may, I love the word may, Dr. Schulze doesn't use may, it either works or it doesn't, may solve this problem more effectively than antibiotics. Well, that's not saying much since most of us know antibiotics don't work very well anymore. Here's Dr. Colleen Kelly from Brown University, uses fecal transplants in her practice. Here's another quote. Now 3 million people in the U.S. are infected annually with C. diff. That's a good percentage of us now, so we better listen up to this. Okay, what does the Mayo Clinic say? I looked on the Mayo Clinic's website this morning, and they say that C. diff typically occurs after antibiotic treatment in the hospital. Okay, so this is something that is probably caused by taking antibiotics in the first place, so why would we want to take more antibiotics to treat it? I also found another site that said 14,000 people in America are now dying every year from C. diff because they're ingesting the spores of this bacteria. Where? In bars, in nightclubs, in brothels? No, in hospitals. Okay, 14,000 people a year are dying because they're inhaling spores of this horrible bacteria in hospitals. Okay, what could be some healthy alternatives here? Because since it's caused by antibiotic treatment, we don't want to take antibiotics. So I would do what I did in my clinic and what I called corrective bacterial injections. And my mother actually used to do this. It's called sauerkraut. Okay, it's called fermented vegetables. Okay, I know when my mom made sauerkraut, she put cabbage in a bowl with water in the closet, put a plate on it, a rock on that, and it started reeking, and half my friends wouldn't come in the house. Okay, but you don't have to make your own sauerkraut. There's a ton of wonderful companies in the health food stores that are making all types of fermented cabbages, fermented beets, kimchi, all that food, reintroduce that healthy bacteria back into your bowel. But there's also all sorts of yogurts, and you don't have to drink pus and blood infected cow yogurt. You can have soy yogurts. Okay, here's one here, a great soy yogurt, blueberry. Here's another one here, cultured In coconut milk, Yahoo! And both of these have all the bacteria, loaded with bacteria. And here's one here called BioK. Get the dairy-free one. And this has 50 gazillion bacteria in it. And, okay, let's take these off my lap. 50 gazillion bacteria in it that's going to reintroduce healthy bacteria into your intestines. Okay, so remember, fermented vegetables, non-dairy yogurts. People today talk a lot about probiotics, and I see people taking pills and probiotic pills. You know what probiotics are? My mother's sauerkraut and that soy yogurt and all your fermented vegetables. You don't need to take the pills. You don't need to take the potions. Just eat your fermented vegetables. But maybe first what we should do is clean out the old. We got to get rid of that old bacteria, and the best way to do it would be my 5-day bowel detox right here. My 5-day bowel detox. Why? Because the 5-day bowel detox is going to get your bowel working well, but it's also going to absorb and clean out all that poisonous bacteria, the C. diff, absorb it, kill it, and get rid of it. Also, if you don't need to have more bowel movements, if you already have C. diff and lots of diarrhea, you may just want to use the intestinal formula #2. Don't monkey around with the capsules. Those are for the bowel detox. But if you're really sick, you want to use the powder and a lot of it, you could double, triple my suggested dosage of 5 spoons a day to 10 to 15 spoons a day. Okay, now you also want to flood yourself with the healthy bacteria, but take a week and get rid of that C. diff and all that old stuff in there. And why not some garlic? We know that garlic destroys gram-positive and gram-negative bacteria. It destroys C. diff bacteria. So load yourself with garlic. What's that? 1 clove, 2 clove? I had patients that did 50 and 80 cloves of garlic a day and turned themselves around almost overnight, and then boost your immune system with Echinacea Plus. Double, triple, quadruple the dosages. Use it for a month. Nobody ever hurt their immune system by taking too much Echinacea because, let me think, you can't take too much Echinacea, so get it in. And in extreme and difficult cases, you might go out and get some colonic irrigations. Intensify your #2. Take 3-4 times the dosage I suggest. Garlic, I wrote it down here again, 50 cloves a day or more. You might do a 30-day bowel detox, which would be, don't do a 5-day bowel detox, do a 10, 15, 20, 30-day bowel detox. And you might even consider some implants, wheatgrass, healthy bacteria, garlic. I did all of those in my clinic. You can get them done at a colonic therapist. So Vicky from Lodi, California, the first step is preventing C. diff. What do we know about it? 3 million Americans are getting it a year. 14,000 a year are dying from C. diff. How do people get it? They're getting it from antibiotic treatment, and they're inhaling the spores or ingesting the spores in the hospital. So stay out of hospitals and stop taking antibiotics. That's how you can prevent getting it. And if you do get it, think about the 5-day bowel detox. Think about Echinacea Plus. Think about massive doses of garlic. And think about intestinal formula #2 to absorb it and get it out of your body.